I just got off the phone with my insurance company. My doctor had recommended I see a specialist for a second opinion about a cancer diagnosis. The insurance representative, in a flat, neutral tone, said those 5 words that no patient ever wants to hear. "We do not cover that." My heart sank. I was facing a life-changing diagnosis, and the company I had paid thousands of dollars to every year was refusing to let me get a second set of expert eyes. But I didn't hang up. I knew something they were hoping I didn't know. In most states, what they just told me is completely illegal. By the end of this video, you will know the 3 legal weapons that force an insurance company to cover your second opinion, the exact words to say to their customer service agent, and the step-by-step letter template I used to get my own denial reversed. Let me start with the number 1 thing you need to know. Most denials for second opinions are not based on a real rule in your policy. They are based on a bluff. They are hoping you just accept their no and go away. But many states have laws that specifically protect your right to a second opinion. And the Federal Affordable Care Act gives you powerful appeal rights that they must follow. A 2026 legislative analysis from Pennsylvania confirms you have the legal right to appeal a denied claim if you feel it should be covered. In 2023, people on Medicare Advantage plans succeeded in reversing prior authorization denials 82% of the time when they appeal. Those numbers are not hypothetical. They are the actual odds of success when you refuse to take no for an answer. So why did my insurer say no to a second opinion? They claimed it was not medically necessary. They said the first doctor's opinion was sufficient. This is the most common reason for denial, but it is also the easiest one to fight. A 2026 article from Vernon Agency confirms that procedures such as surgery or cancer treatment are more likely to qualify for second opinion coverage because they involve major medical decisions. An insurer cannot just say it's not necessary. They have to have a clinical reason, and your doctor's recommendation can override their bean counter logic. Now, here is the pattern interrupt that most people never learn. You do not have to accept the final answer from the first customer service agent. You are legally entitled to an external review. This is where an independent medical expert, not a company employee, reviews the denial. If the expert agrees with you, the insurance company is bound by law to pay. A 2026 Pennsylvania Department of Health bulletin notes that the independent external review process helps Pennsylvanians by providing them with an additional outlet to exercise their right to appeal a denied health insurance claim. This is your nuclear option. It is free for you to file, but it forces the insurer to spend money defending their decision. Usually, they will settle long before you get to that point. Let me give you the step-by-step plan to force them to cover it. I used this to get a second opinion from a top specialist at Johns Hopkins, fully covered. Step 1 is to ask for the specific reason in writing. Get the denial letter. Do not accept a verbal explanation. You need the actual policy clause they are using. Under the Affordable Care Act, they must provide this. Step 2 is to go back to your original doctor. You need a letter of medical necessity. This letter should state, in clear terms, why the second opinion is essential and not just a luxury. A sample letter from Survivorship A to Z is a perfect template. It says, I am writing to request that a physician outside Dr. Jekyll's medical group confirm the necessity for the surgery. I need a second opinion to determine if other treatments would cause less stress on the body than surgery, their effectiveness, and their cost. The magic word here is necessity. Without that letter, the insurance company will argue the first doctor was enough. With it, you have a medical professional stating the opposite. Step 3 is to file a formal internal appeal. This is not a phone call. This is a written letter. You can use the template from Survivorship A to Z, which requests a specific out-of-network doctor and asks for an expedited appeal due to the urgency of the situation. If the insurer continues to stall or deny, you must file for an external review. According to legal resources, you usually have 4 months from the date of the final denial to request this. While you are fighting, do not stop your treatment. If the need for the second opinion is urgent, consider paying for it yourself and seeking reimbursement afterward. Expedited appeals are generally handled within 72 hours, but bureaucratic delays can happen. Do not let their paperwork delay your health. Now let me address the differences in the United States, Canada, and the UK, because your rights vary dramatically. In the United States, your right to a second opinion is often protected by state law, not just federal law. For example, New Jersey regulations explicitly state that a second surgical opinion cannot be mandatory, and insurers must provide access to specialists. Maine law prohibits requiring a patient to get a second opinion from a provider in the same office as their primary doctor. And Maryland requires insurers to cover an objective second opinion when required by a utilization review program. The New Jersey statute also requires that the specialist providing the opinion is independent of the physician who makes the original recommendation for surgery and has no financial interest in the outcome. This prevents your surgeon from pressuring you to go to their buddy for a rubber stamp approval. For Canadians, the system is different because your province handles the core care. However, if you have private health insurance through work or a personal plan, many now include second opinion services as a specific benefit. Desjardins Insurance notes that you can get a second opinion from a specialist physician on a diagnosis, treatment plan, or surgical procedure for any medical condition. Major providers like Sun Life and Manulife offer expert second opinion access, sometimes as a free add-on to extended health care or critical illness policies. As of April 2026, IA Financial Group now provides a medical second opinion service free of charge to its critical illness insurance clients, partnering with Novus Health. If your employer plan offers this, it may be an easier route than fighting a public system for a transfer. In the UK, the situation is entirely unique because you have the NHS. You do not need insurance to access a second opinion. The Royal College of General Practitioners advises that any patient has the right to ask for a second opinion at any time. If your NHS GP or consultant refuses, you can ask their supervisor or contact the Patient Advice and Liaison Service. For those with private medical insurance, the rules are similar to the US. Most comprehensive UK policies explicitly cover second consultations. A 2025 guide from Wecover notes that many policies include dedicated expert second opinion services as a value-added benefit. You usually need a referral from your GP, but the process is generally smoother than in the US because private insurance is designed to work alongside the NHS. Let me recap the key takeaways. Number 1, do not accept a verbal no from an agent. Get the denial in writing. Number 2, a letter of medical necessity from your doctor is the single most powerful weapon you have. Number 3, you have a legal right to an independent external review. Use it. Number 4, in the US, New Jersey, Maine, and Maryland have strong state-level protections for second opinions. Number 5, in Canada, check if your private plan includes a medical second opinion benefit, as many do. Number 6, in the UK, the NHS must facilitate a second opinion if you request one. Private insurance makes it even faster. Number 7, time is critical. If your health is at risk, pay for the second opinion yourself and fight for reimbursement later. Number 8, Your health is more important than their paperwork. Here is what I want you to do right now. If you have been denied a second opinion, do not stew in frustration. Open your health insurance app or grab your physical card. Find the customer service number. Call them back and ask this exact question. What is the process for an expedited external review of my second opinion denial? Their tone will change immediately because they know you know your rights. You can get that second opinion. You just have to ask the right way. If this video helped you understand your rights, hit the like button. It helps more people get the life-saving care they need. Subscribe and turn on notifications so you don't miss my next video, which is called The One Sentence That Makes Every Insurance Agent Change Their Answer. And comment below. Have you ever been denied a second opinion? Share your story. I read every single comment. Thanks for watching. Now go fight for your health. See you in the next one.